Good morning and welcome to Dr. Murphy's Public Health for You or Ask Dr. Murphy series. I hope everyone is doing well today. Happy New Year. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing fine in the new year.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines that occurred over the new year and this week through January 9th. We welcome any questions or comments down below or at any of our social media linked in the description. Starting with the big story, flu cases are rising all across the US. Can you bring us the latest, Dr. Murphy?
Yeah, so flu, this is the big flu month. It's took off a little earlier this year than usual, but it's really taking off now, and it is going like gangbusters. This has resulted in 11 children dying from the flu so far, and 5,000 adults have died already in this flu season. These numbers are expected to triple at least by the end of the flu season, which is the end of March and beginning of April. That's our typical flu season. So we have a different kind of flu strain this year. This is H3N2. It's an influenza A type virus, and it's a little bit nastier. It's a worse virus than the usual ones that come along. And we're all paying the price. This is a worldwide phenomenon. It's really up everywhere. This is it. If you're really, really sick, you need to get tested for flu, and there is treatment for it for children and for adults.
Mhm. And speaking of another worldwide phenomena that we saw in many countries, including the United States, over the year of 2025 and into 2026, measles. Can you give us the final updates from 2025 and how we're looking going into this year?
Yeah, so measles, we have 2,144 cases, which is about half or less than half of what's happening in Canada. Canada's in just as bad a shape as we are. And this has resulted in 3 deaths, 2 children and 1 adult, none of them vaccinated. And it's the same strain has been floating around now for the past 12 months. So this is not it's not going away. And with the vaccination rates going down right now, especially in the places that drop below 95%, this is going to continue. It may not go away. This may just be what we have to live with.
Yes, we will, of course, keep watching that as we roll into 2026, where the cases are popping up and if there is any lowering in transmission.
I
But
mean,
you,
people get sick with measles. We have the 3 deaths, but there's hundreds of hospitalizations as well.
Mhm. Yeah. And on that note, you're talking about those vaccination rates. That may change as well, as over the holiday, there was a massive, massive overhauling of the US vaccine schedule by the Department of Health and Human Services. Can you tell us the changes?
Well, yeah, the committee that reviews the vaccination schedules was completely disbanded under Robert Kennedy, and a new one put in place full of vaccine skeptics and people who are not experts. They're opinionated, but they're not experts. And they have decided to change the universal policy and limit the recommendation to everybody getting vaccinated for only 11 of the 17 diseases that formerly were recommended. Now, they have modeled this after Denmark. Denmark, you think very advanced country with a great health system. Denmark has 6 million people. It's about the size of Wisconsin. That very homogeneous. They have guaranteed health care from birth to death. It's a very healthy country in general. Everybody is screened for everything and everybody is plugged into the healthcare system. That's not how it works in the United States. That system to transplant here is so strange. But that's basically the cover they're using to justify these changes. It's ridiculous. They still recommend vaccination against measles, mumps, rubella, polio, pertussis, tetanus, diphtheria, Haemophilus influenza type B, pneumococcal disease, and HPV, which can cause cervical cancer in women and anal cancer in men and women, and chickenpox. Then they put into another category for high-risk groups, RSV virus, also hepatitis A and B, dengue, and two vaccines targeting bacterial meningitis. And then they say a shared decision should be made for rotavirus, causes diarrhea, influenza, meningitis, also hepatitis A and B. And another important change included is they are only recommending one dose of the HPV vaccine, which is not as effective as the two doses. So when you put these obstructions or these steps into any kind of formula for giving vaccines out, people drop out along the way. And just the nature of public health, a lot of people will not be vaccinated because of this recommendation. This is more individualized health, and we're talking about public health. And other groups now are making their own recommendations, like the state of Illinois. We didn't change. State of Illinois did not change. We're following the old system. The old system worked. American Academy of Pediatrics, they didn't change. The Infectious Disease Society of America and many other professional societies are not changing any of their recommendations. And the governors of these states, including Governor Pritzker here in Illinois, is going along with this as well. And we're going to keep the state of Illinois and many other states too as healthy as possible.
Mhm. And it's worth noting that public health experts have noted that over the past 30 years, these vaccine recommendations have saved over 1.1 million lives. It's a
Preventable
huge, huge
diseases.
change.
All the diseases I've just mentioned are preventable diseases that can kill children.
Mhm. Very, very scary stuff.
Very sad.
And some more unfortunate news is that despite pressure from this administration and previous ones, drug makers in this country still plan to raise prices on over 350 medicines. Can you tell us?
Yeah, so apparently pharmaceutical companies on their own to do whatever they want to do. This is what happens in our capitalist society, and that's okay. We have to pay for the development of all these drugs, which can cost $1 billion or more to actually develop these drugs. So they deserve to have the money returned to them to continue to develop other drugs. Many drugs that they try to develop bomb out along the way. They spend a lot of money developing drugs. So anyway, just Arbit kind of annually just raising 4% or whatever. The cost of developing the drugs for those particular drugs hasn't changed at all. The cost of goods, the actual making of the tablet, is oftentimes measured in pennies or dollars. I mean, it's not very expensive to actually manufacture the drugs. And, it's just a shame. So when these companies come into Europe and the big five countries in Europe and all the countries in Europe, they have to negotiate with the government on the price. And so the government negotiates for everybody. Here we just have too many different insurance companies, all trying to get the best price and whatever. And there's, it doesn't work. And so what happens is the price goes up. Now, their patent protection will run out, and the generic drugs will come into play, and that will lower the price.
Mhm. Now, one story that's a little bit different that we haven't talked about much, something we haven't had to pay attention to, I could say, is tetanus. And as you were just talking about the vaccines, we are seeing declining vaccination rates in that realm too. Can you tell us about the change?
Yeah, tetanus vaccination, like all of the vaccinations, has dropped off. This year we had 37 cases in 2025. We had 37 cases of tetanus. This is unbelievable. People get very sick with tetanus. I mean, you can even die. But this is just another disease that's going to come back. We're getting unhealthy again.
Hmm. And on that note, our final story today is a shocking one out of Mississippi. Public Health measured the rate of maternal syphilis over 10 years. Can you tell us those results?
Over the last 10 years, the maternal syphilis rate has increased 1,000%. So why is this important? Because the mother can transmit it to the baby. The baby gets congenital syphilis and all these medical problems associated with that. So this has gone from 86 cases per 100,000 to 1,000 cases per 100,000 people. And it's just a disaster. In Mississippi, they reported. I just looked up some interesting data on health status in Mississippi and other states. Like, what's the worst five states for adults and the worst five states for kids, and then what are the best? So the worst ones are West Virginia, Mississippi, Kentucky, Louisiana, and Alabama. That's for adults. For kids, it's Mississippi, Texas, Wyoming, Oklahoma, and Alabama. And if you look at the best states, Massachusetts, Maryland, New Hampshire, Minnesota, and Utah were the best states. So there's a huge difference in the United States between people that do really well, avoid these preventable diseases, and those that do badly. But this is really a very sad story, what's going on in Mississippi.
Very, very sad, and one that we will try to keep up with as much as we can as more information comes out and throughout this whole year of 2026. If you have any questions or comments, things you want us to check in on as we roll into the new year, please let us know. But on that note, I'd like to thank you, Dr. Murphy, for your time and your expertise. So important to stay up to date on this. So thank you.
Thank you.
And thank you all for joining us. Happy New Year. Again, any questions or comments down below, we look forward to hearing from you. Bye bye and have a great weekend.